Good afternoon. Sorry to be starting a few minutes late. Just got off a call with the Prime Minister and other premiers talking about vaccine and other matters, and I'll have more to say about that at a news conference tomorrow. But today I'm here with Dr. Hinshaw to provide both the daily update as well as to make announcements with respect to the in-class instruction in schools and the next steps ahead for Alberta's effort to combat COVID-19. Today, there are 13,298 active cases of COVID-19 in the province. That's an increase of 968 cases on 14,833 tests for what we call a positivity rate of 6.4%. 871 Albertans are in hospital with COVID-19, 139 of whom are in intensive care. Sadly, 24 more Albertans have passed away from COVID-19, meaning that 1,217 Albertans have lost their lives to this disease since the pandemic began. On behalf of all Albertans, I extend my condolences to the families and the loved ones and each and every one of them. On November 24th of 2020, I announced that students in grades 7 through 12 would move to at-home learning on November 30th, 2020. This would be for 19 days prior to the Christmas break that started on December 18, and all students from grades K to 12 would spend 1 week learning at home until in-person classes were to resume on January 11th. That was the plan that we announced before Christmas, and today I am pleased to announce that we are sticking to that plan, and we can confirm that classes will resume as planned on Monday, January the 11th. The decision to resume in-class learning on January 11th is based on carefully considering the importance of attending school in person, as well as the latest evidence of cases dropping in all school-related age groups in December. And this is based on advice both from our Chief Medical Officer as well as the Minister and Department of Education. Schools play, of course, a key role in supporting student learning as well as their emotional health, mental health, and overall well-being. At the beginning of the school year, families across Alberta made the choice that was best for their kids and their family situation as to whether or not to have their children attend in-person class this year. While about 20% of families and students chose to learn at home, the majority of parents chose in-school learning. For younger children, learning at home can be often challenging from an academic, social, and emotional perspective, especially for parents who didn't make that choice. And it also often puts at disadvantage, in particular, kids from families living with perhaps lower incomes who don't have the easiest access to technology to keep their kids learning online. And we also know how important a classroom environment is where children can interact with teachers and with their peers. A long break from that environment can have serious impact on the mental and emotional health as well as the well-being of young people. For those families that chose in-class instruction, I want to thank all of you, as well as, of course, the teachers and supportive staff, the principals and others who adapted to this challenging situation and got through the week of at-home learning this week. I want to say a special thank you as well to our students and teachers in grades 7 to 12 who have been learning at home since November 30th and have done a great job despite the challenges. I know that some of you might feel anxious about putting your backpacks on and going back to class on Monday, but it's important to note that between September and the winter break, only 0.4% of students, that's 0.4%, less than 0.5% of students and school staff tested positive for COVID-19. Now, even though the vast majority of students and staff did not get the virus, many nonetheless face challenges and disruptions as a result. And I know some still have serious concerns about the coronavirus, and understandably so. But we have a practical plan that will always put the safety of students and school staff first. We'll make changes as necessary to ensure there is a safe learning environment during the pandemic. Dr. Hinshaw will speak to the safety of returning to in-person class shortly. And let me just say that to all of our teachers, principals, and other school staff, I thank you for all that you are doing to help get our students through this pandemic. However, while there is a reassuring trend in a drop in cases for all school-age groups in December, following the most recent restrictions, COVID-19 does remain broadly spread across Alberta with few exceptions, with few local exceptions. Testing numbers did drop over the holidays. That was anticipated. But we saw a continued high positivity rate. And let me just pause there to put that in context, because I think maybe we got a bit used to high numbers in the past couple of months. But I remember from basically May through the end of September, a bad day would be a 2% positivity rate. And in the last week or so, we've been seeing about 7%. It's also important to underscore that even though we have seen the number of active cases drop pretty substantially since measures were introduced back in November, the reality is that we are ahead of most other Canadian provinces on a per capita basis for total active cases, new cases, and most sadly, COVID fatalities. So we need to understand we've made progress, but we are far from getting out of this. All of this suggests that we would have seen much higher case numbers over Christmas if the testing was at the same level as it had been prior to the holiday. And although we saw a peak in ICU and hospitalizations at 155 patients and 953 overall, our numbers for both metrics have not gone down significantly. We just clicked under 900 today. It's still far, far too high. And Alberta, in this respect, is not alone. Across the country, with the exception of the East Coast Atlantic bubble, all other provinces saw a significant increase in cases and hospitalizations in November. And while the active cases in provinces, Western Canada, I should say, are going down from their peaks, we still, as I say, do face high numbers. And active cases in Ontario and Quebec continue to go up, as in places all across the Northern Hemisphere around the world. In order to ensure that we take into account the very real possibility of an increase in cases as a result of the holidays, and given the fact that our case numbers, hospitalizations, and positivity rate for testing remains high, Alberta's current health measures will remain in effect for at least 2 more weeks. Let me pause to say that when we announced the current policies back in December, we said that we would review them in a month. We had a lengthy meeting of the COVID Cabinet Committee today to review this, the latest up-to-date data, and on things like hospitalizations, the rate of transmission, the positivity rate, and all of that. And we took the advice from our Chief Medical Officer. We need some time to see what impact, once the testing stabilizes post-Christmas, we need to see what impact the holidays had on testing. And, of course, we also need to prioritize reopening the schools as we are doing and begin to see what impact that may have, although we are confident it will not accelerate widespread social transmission. That has not been the case in the past. That means that all Albertans, businesses, organizations, and service providers must continue to follow existing health measures until at least January 21st. Now, I know this is particularly frustrating to hear all of this right now when you've seen news stories about politicians and political staff traveling abroad, and let me address that. I know that Albertans are angry because of the terrible judgment that many in government have shown, and they are right to be angry. I had heard Albertans loud and clear. After all of the terrible sacrifices that people have made for 10 months, it was insulting for government leaders to holiday outside of the country. Albertans said they wanted there to be consequences. I heard them, and there have been serious consequences. They were right to make that demand, and that is why those responsible lost jobs, and suffered demotions, and we have changed our policies to ensure that elected officials, people in senior positions of public trust, do not travel abroad during this pandemic unless it is for truly essential business reasons. I don't foresee those circumstances. I know many people are deeply frustrated and they are right to be frustrated. But that frustration cannot stop hard decisions that must be made to protect public health. Trust has been broken, and I accept that that trust must be repaired. After the last election, MLAs, ministers, myself, set the right tone by taking voluntary pay cuts. We need to show Albertans that a renewed sense of that kind of leadership. We also need to show discipline as a team. And let me pause to say that I will be working with the UCP caucus to ensure that culture of discipline. And that starts with ensuring that people comply not just with the letter, but also the spirit of both the public health restrictions and guidelines. It is the very least that can be done. And so I apologize to Albertans for what happened, for these bad decisions. As I said last week, I accept responsibility for not having laid down even clearer expectations for members of my team. I am deeply disappointed, and you too have a right to be as well. Now, having said that, let me close by saying that health officials are actively evaluating the latest public health data and will continue to do so over the coming weeks. I want to assure you that businesses, organizations, service providers, and others will be given at least a week's notice prior to changes that will affect them, so they have time to plan, because what they're asking for is certainty and predictability. So with that, I will hand the podium to Dr. Hinshaw, and then we'll afterwards be happy to take your questions, and we'll be making another statement tomorrow about our progress on vaccinations and related issues.
Thank you, Premier, and good afternoon. The Premier already provided today's high-level numbers, so I will keep my remarks brief. We have seen a decrease in the spread of COVID-19 in Alberta since restrictions were implemented in early December. This is a testament to the hard work and sacrifice of many. However, the spread of the virus is still very high in our province. While today's cases dipped below 1,000, we are still averaging well over 1,000 new cases daily. This is lower than the 1,877 detected on December 7th, but it is still too high. Currently, there are more than 13,000 active cases in the province. This is again a decrease from December 13th, when there were more than 21,000 confirmed cases in the province, but it is still a far cry from the 1,000 to 2,000 active cases we had throughout the summer and early fall. Alberta's peak hospitalization for COVID-19 patients was on December 30th, with 953 people admitted, 145 of whom were in the ICU. We have come down slightly, but our hospitalizations remain high. Our healthcare system is still under extreme pressure, and this is impacting our ability to care for all the health needs of Albertans. Prior to the significant spread following Thanksgiving, our peak hospitalization in late July was at 94 cases. Today, our numbers are almost 10 times that. We still have not seen the impact of the recent holidays, and we will be closely monitoring the spread over the coming weeks to determine whether it is safe to recommend beginning to relax our current approach. As the Premier noted, schools will resume in-person learning on Monday. This is based on the evidence we saw in the fall that in-school transmission was not the main driver for cases in the school population. In fact, analysis of all of our cases in school-aged children indicated that only about 6% of all of these cases were determined to have been acquired at school. This is further supported by the observation in December that although elementary-aged children remained in school in person, their age-specific case rates, which had previously been rising, dropped in an identical way to older students after extracurricular activities and social gatherings were limited. We are prioritizing school return next week while keeping these other restrictions in place, as these other activities seem to have been a much more important driver of spread. Supporting our students to be in school provides a great benefit to our society and underscores the need to continue reducing community transmission to protect our schools. There are no risk-free options with COVID, but as I have outlined, our data indicates that the current school model in place is largely effective at limiting in-school transmission. The key to keeping our schools, workplaces, continuing care facilities, and rest of society healthy is limiting the transmission in our communities. We cannot dictate where this virus does or does not spread. High levels of community transmission impact all of us. That is why it is essential that we continue to keep the current measures in place. I know this has been a challenging last 4 weeks, but we cannot relax our grip. We must stay the course. I continue to ask Albertans to limit in-person interactions as much as possible in every facet of their lives. The progress we make over the coming weeks will help determine how the coming months look in our province. We still are all in this together, and we can reduce the spread in our province by working together and protecting each other. Thank you, and we'll be happy to take questions.
A reminder for those on the line, as always, there are a lot of you in the queue, so please be brief and limit yourself to one question. Operator, can you please put through the first caller?
First is Jeff Slack with 660 News. Go ahead, Jeff.
Hi there. This question is for the Premier. I understand you're apologizing and saying people have a right to be mad about the travel controversy, but why on New Year's Day did you say you weren't going to sanction members of your party and 3 days later took disciplinary action? Why did you take action right away during your press conference on the 1st when you told the public you knew members of your party vacationed outside the country?
Well, to be clear, I didn't know that members of caucus had vacationed outside the country. As I said on January the 1st, I first learned about members of our caucus having traveled outside the country on Tuesday of last week, and it frankly wasn't until Sunday, this past Sunday, that we had fully established the whereabouts of everybody, which points to a breakdown of discipline in this caucus that has to change and that will change. I was aware, as I said on January 1st, that my former chief of staff had advised me, as he basically said he was on his way to the airport, about his travel plans. I should have put a stop to that. I accept responsibility that I didn't, and I also accept responsibility that we didn't have a strong enough culture of discipline in the caucus, the government caucus, for people not to even think about traveling abroad at this time. What I said then was that I didn't think it was reasonable to impose sanctions, given that I had not been sufficiently clear to absolutely ban and say there would be consequences for traveling abroad during the pandemic. And but what happened over the weekend is last weekend I heard very clearly from Albertans about their anger, their disgust, their frustration, and their understandable demand that there be real, serious consequences. So I listened and acted accordingly with the disciplinary action that was taken and announced this past Monday. And we've taken other actions to begin building a much stronger culture of discipline. As I said on January the 1st, it's never come naturally to me to think about tracking the whereabouts of what people who I work with do on their personal time. And I accept responsibility that buck stops with me. And I created a culture. I was ultimately responsible for creating a culture in our caucus that has not been one of sufficient oversight on what people are doing. And that simply has to change. So that is changing. We've given the direction that no senior people in government are to travel abroad at this time, unless they are for absolutely essential business reasons. I don't see any reason for that forthcoming. But once again, I listened to Albertans. They sent a very clear message and acted accordingly.
Operator, can you please put through the next caller?
Yes, next is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon. Just a quick question to the Premier. Just following your remarks, Do you think the events of the last days, Premier, which have been very difficult, make it more difficult for your government to make a decision on the COVID-19 file? And I think what I mean by that is, do you think that, the public buy-in, the public frustration, all of that, do you think it makes it harder for you to hold this, fairly hard line, given the events of the last few days?
Well, Rick, I'll put it this way. I think that it's certainly a factor that weighs on us. And in our discussion at our COVID Cabinet Committee today, I was very blunt about that. And I was aware of that, I have to confess, on Thursday night when I first became, when Minister Allard came back and we were starting to finally get more complete information on the whereabouts of folks in our caucus. I realized there was a very real problem, that this could impair the moral authority of government to ask Albertans to continue to make these deep sacrifices. I've shown, and our team has shown, that there are real consequences for this kind of unacceptable behavior. And we'll have to continue showing to Albertans that we've learned the lesson, we've heard them, and we have to rebuild a culture of discipline and of humility. And that's all we can do. But I cannot, as Premier, allow any of that to take risks with people's lives and livelihoods. We cannot let, and we've tried to avoid from the very beginning, all of these different kinds of, if you will, political considerations from infecting the hugely important public health and other decisions we have to make. We've always tried to do in a balanced way, and I'll say that I think we are. If you look at other jurisdictions, we are still doing it in a reasonably balanced way. The public health restrictions in Alberta continue to be less stringent than across Canada in most areas. And that is because we have tried to balance off all of the considerations, including people's mental and emotional health, their social and economic circumstances. So that will continue to be our guiding light. And while the events of last week were deeply unfortunate, they were wrong. They required the kind of consequences that they got. The reality is that we have to continue to keep our eye on the ball, which is protecting people's lives and livelihoods, and that's what these announcements do today.
Operator, can you please put through the next caller?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi there. I've got a question for the Premier about the meeting with the Prime Minister. I understand the provinces are pushing on the issue of the vaccine supply. How concerned are you about the supply issue, and what more do you want from the federal government that they're not already doing? And just a related question to Dr. Hinshaw, how soon will the province be at the point where we're just simply out of vaccines, and that's the main sort of limiting factor?
Well, James, we're going to have that's the subject of tomorrow's news conference, so we're still updating our numbers and projections in that regard. But let me say that we are concerned that as we pick up the pace of inoculation, that the supply will be inadequate. And I've heard other premiers express the same concern. Now, I'm not pointing fingers, but the Government of Canada is responsible for the procurement, and I have conveyed to the Prime Minister, as have my colleagues, the urgency of getting as much supply here as we possibly can. Because my instructions to AHS has been to go as fast as they can, to use every dose that we possibly can to get people inoculated. Every day that somebody is not inoculated is a risk, particularly in the high priority groups. It can even be a risk to their lives and the lives of others. So this is a matter of the greatest urgency. We see other jurisdictions getting greater access to life-saving vaccines, and we hope that we can work with the federal government in whatever way possible to get faster and more reliable supply to keep up with our capacity to inoculate. But I'll be saying more about that tomorrow, and I think Dr. Hinshaw may, you've asked her for a supplementary answer.
Thank you. So I think the question for me was the timing of when we will run out of vaccine. And I would reiterate what the Premier said, which is that we've been working with Alberta Health Services to accelerate the delivery of the vaccine that has arrived in the province. We know that there are many Albertans who can benefit from it, and so we're working hard to get that into people's arms who want that vaccine as fast as possible. We do know this is, of course, with these two new vaccines, a new technology that does require additional complexity in handling and storage. And so there's been a lot of learning over the past few weeks as we have been working with Alberta Health Services to ramp up that distribution. And I think we're well positioned to be able to use the vaccine that arrives in very short order, shortly after it arrives. And again, we're working on all of those things with AHS. So I don't have a particular date. We do receive shipments of vaccine on a regular basis, and so we do always have some vaccine coming in. And our goal is to be able to use that vaccine as quickly as possible after it arrives so that we can get the maximum benefit for it for Albertans.
Operator, can you please put through the next caller?
Next is Elise Von Scheel with, all right, I'll find you in the list, one moment. Elise Von Scheel with CBC. Go ahead, please.
Hi, Premier. Thanks for taking my question. I'm wondering if more members of your government are found to have traveled during the holidays or travel now despite your new directive. Will you apply the same consequences to them?
Well, yes, and let me be clear. I've defined this as people who have senior positions of public trust. And so I have, look, there are over 250,000 people who work for the broader Alberta Public Service, and I have no doubt that a significant number of them have taken or are taking vacations abroad. And I don't think it's my business to regulate all of that. Quite frankly, for many of those people, it would be a violation of their collective bargaining rights and so on. So this is, when you say anybody that works in the government, that's not the standard here. The standard, or rather I think the expectation, the quite a correct expectation of Albertans for a higher standard of conduct applies to people who hold significant positions of public trust. And I've defined that as elected officials as well as senior political staff who are in key decision-making positions, as well as executive leaders in the Alberta Public Service. And I know that my Deputy Minister has conveyed that to his colleagues. But I think for people who are not in key decision-making positions, who exercise the same rights as other citizens, the right to travel, I think it would be really problematic to start picking those people out. I don't know where that would end, quite frankly.
Okay, we have time for 3 more questions. Operator, can you put through the next caller, please?
Next is Carl Sisset with CTV. Go ahead, Carl.
Hi, Premier. Thanks for taking my question. My question has to do with the fact that for 4 days in a row, #FireKenny, #ResignKenny were trending on social media, and many are calling for more action beyond the sanctions that you've handed down within your team. So as someone who, even today, is claiming personal responsibility for not being clear enough with your team, what do you say to Albertans who say you yourself have lost the moral authority in this situation?
Well, I say that I have done everything I can to comply with the spirit and letter of the COVID rules and guidelines. I had a very solitary Christmas. For most of the past 10 months, I've only been able to do window visits for the only member of my family in the province, my 83-year-old mother. And I have tried very carefully to, as I say, follow the spirit and the guidelines. I have only been out of the province once since the pandemic started, and that was to go to Ottawa for a day to meet with premiers and senior federal officials. I have not been out of the country since I was speaking to the National Governors Association in Washington in February, before the pandemic began. So believe me, I racked my brain to think about anything I may have done that would be a significant departure from the guidelines and rules, and I can't think of anything. But I accept that it's a broader problem of a lack of discipline in our team that allowed this to happen, I believe. And with that, the buck stops with me. in terms of Twitter hashtags, believe you me, I don't govern according to Twitter hashtags. That would be a recipe for chaos for any government. We are continuing to focus on the implementation of our agenda, doing what we said we would do, focusing, of course, on protecting lives and livelihoods through the pandemic. Right now, particularly on accelerating the vaccine program and on those critical issues. And so that would be my answer.
Operator, can you please put through the next caller?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Mr. Premier. You're telling Albertans to travel. Infectious disease experts say that is not a good idea. The province's travel advisory discourages travel. So what's the scientific basis for your stance? And to Dr. Hinshaw, where should people be turning for public health advice on travel?
Well, Julia, I must correct you. I'm not telling people to travel. Rather, the position of our government has been to facilitate safe travel, because travel is happening, and it's best that when it happens, it be safe. That's a point I've been making from the very beginning of the pandemic. Julia, you may recall at the beginning of the pandemic, when the Government of Canada refused to close travel from COVID hotspots because they implied it would be bigoted to do so, I called them out and said that it was irresponsible to keep flights open from, for example, parts of China, parts of Italy, from Iran, that were bringing people to this country from COVID hotspots. I'm glad they finally listened to that advice and did impose those kinds of travel restrictions. And then later in the spring and the summer, I recommended that we emulate the example of places like, at the time, Iceland and Austria, with very, very large tourism economies, to facilitate safe travel. For example, I specifically recommended to the federal government a requirement that people boarding flights to Canada provide evidence of a recently obtained negative COVID-19 test. And that is something I've recommended to them for months. I'm glad that has been instituted today, actually, on January the 7th. I wish it had happened earlier, but I'm glad it's happening. Of course, our government worked with the federal government of Canada to adopt the travel pilot program, which we did, and with obviously based in part with the involvement and approval of the Chief Medical Officer of both Alberta and of Canada, the head of the Public Health Agency of Canada. And in fact, we were just having a good conversation with the premiers and the Prime Minister about the success of that program that has seen 20,000 people voluntarily enroll in it, and has been a good tool for faster contact tracing if a positive person came here on an airplane. So our point has been that travel does and will continue, and given that reality, we want it to be as safe as possible. I quoted last week, and by the way, what I oppose is those and who, of course, we've always had from the very beginning people who want to shut absolutely everything down, regardless of the broader cost to people's livelihoods, their mental and emotional health, their ability to care for their families, and the long-term economic consequences. And there are some people who wanted to shut travel down. I think they've been mistaken. And indeed, recent studies conducted by Harvard University and the U.S. Department of Defense both have indicated that air travel is typically a lower vector of transmission for COVID-19 with all of the multiple layers of protection than, in fact, regular daily activities like shopping at a grocery store. So, you know, with the kind of policies that our government has long advocated, just think about this. If you are flying to Calgary, before you board the flight, you need to take a test, have proof of a negative test. You have a temperature check and a symptom screen administered by the airline before you can board the flight. You have to wear a mask on the flight that has been sanitized. There are HEPA filters operating. You disembark. You have another temperature check administered by CBSA and PHAC at arrivals. If you're at Calgary, You also then can enroll in the pilot, so you're being tested before and then after a second time. So you're talking now about 3 tests. So the point is, in a world where travel must and will continue, I think that's a very strong set of layered protections to ensure safe travel. And Doctor, do you want to complement that?
Thank you, Julia. I think the question for me was about where should Albertans get travel advice. First of all, the advice that my team and I have provided has been to avoid non-essential travel, the recommendation to avoid non-essential travel, and if traveling, to make sure, if traveling within the country to other provinces, to make sure that people are aware of the rules and requirements that other provinces have and to follow those. And if traveling outside of Canada to another country, the Public Health Agency of Canada does maintain a travel advisory list that indicates not just for COVID-19, but for any other health issue, different kinds of things that people who are traveling need to consider. So that would be a good resource for people to get public health advice on travel.
Okay, we have time for one more question. Operator, can you please put through the final call?
Our final question is from Mirna Juchik with Radio Canada. Go ahead, Mirna.
Hi, thank you. For the Premier, Mr. Kenny, vous avez dit les restrictions vont tenir au moins jusqu'au 21. Quand et comment allez-vous décider si on va pouvoir lever les restrictions le 21 d'une part? Et pour revenir sur les voyages des députés, le 1er janvier, vous avez dit que vous n'alliez pas pouvoir sanctionner personne parce que ce n'était pas contre des directives explicites du gouvernement. Puis un jour ou 2 plus tard, on a 2 démissions, des sanctions contre tous les députés concernés. Est-ce que vous pouvez nous expliquer qu'est-ce qui vous a fait changer d'idée?
Certainement. Sur la première question, and just to translate for those watching on Facebook, the questions were about the extension of the current public health orders to the 21st, and then about the travel-related issues. So on the first, so I'm going to provide answers in French that I've already offered in English. Sur la première question, écoutez, j'ai dit en décembre que le Conseil des ministres a eu l'intention à voir la situation au mi-janvier et pour prendre des décisions pour le futur des réglementations de santé publique. Et ce que nous avons vu est pendant les vacances de Noël, il y a eu une grande variation des tests de COVID-19. Alors, nous n'avons pas les données nécessaires à prendre des décisions qui est stable et crédible. Alors, il faut obtenir plus de renseignements, plus de données en ce qui concerne le taux de positivité, le taux de transmission et tous ces autres faits, en particulier pour voir l'impact des vacances de Noël sur le virus en Alberta. Alors, deuxièmement, sur la question des voyages des députés, j'ai dit exactement ça le 1er janvier que pour moi, à ce point-là, ce n'était pas raisonnable à s'imposer les sanctions sur les députés et la ministre parce que je n'étais pas tout à fait explicite que c'était impermissible à voyager hors du pays. Mais j'ai entendu les Albertains. Ils étaient très, très clairs le week-end dernier que ce n'était pas acceptable, qu'ils ont exigé un niveau de comportement plus élevé pour les personnes dans les positions importantes, les positions élues. C'est la raison pour laquelle j'ai décidé que j'ai reçu le message des Albertains. Il fallait avoir les conséquences sérieuses, et c'est la raison pour laquelle j'ai demandé la démission de ces personnes-là. Et je suis certaine que c'est absolument clair maintenant que ce n'est pas permissible pour les personnes dans les positions de décideurs à quitter le pays, certainement pas pour les raisons personnelles maintenant. Thank you very much, everyone.
We'll leave it there for tonight. Have a good night, everyone.